Welcome back, y'all, to the 4th episode of the Up Next Nurse. I have some special guests on today. Okay. I have some old students that, I was educating, and I think these are wonderful nurses. So they are going to tell you some things about themselves. They're going to tell you some open and honest things that are happening in the nursing field right now. So without further ado, is it ado? Okay, without further ado, okay, y'all know what I mean. I want you all to introduce yourself and tell us the area of nursing you're in and how long you've been a nurse. So let's start with you, Arnisha.
Hey, my name is Arnisha. I'm a hematology, oncology, and infusion nurse.
Yes.
And I've been a nurse since 2022.
Yes.
And I'm here to talk to y'all about how real nursing is.
Facts. What about you, Angela? How long you been a nurse?
Hi, I'm Angela, as you already said. Mm-hmm. I've been a nurse since 2022.
As
fall.
well, okay.
Yeah.
And what area of nursing are you in?
I'm an ortho trauma nurse.
Ooh, ortho trauma. Okay, look. This is an ortho trauma nurse. Okay, so what inspired you, Arnisha and Angela, of course, what inspired you to become a nurse?
Really, when I was younger, I was hospitalized, and they didn't really know exactly what was going on with me. I was having pain, abdominal pain, nausea, and vomiting. And honestly, I had more interaction with the nurse instead of the doctor. I can still remember the doctor was a male doctor, and he was so... that didn't stop. It was a male nurse.
Shout out to the male doctors.
Yeah, I mean male nurse, excuse me. Okay. It was a male nurse. And really, he made me feel calm about the situation. They didn't really know what was going on to me, but it happened to be that I was having abdominal seizures. So it was a rare situation, and they kept giving me Pepsi. They thought it was just indigestion.
Wow.
Because it wasn't an actual seizure. But after that, I was like, you know what? I want to be the person that can help somebody be calm in that situation.
Yeah.
So when I made that decision when I was younger.
Okay. She made that decision to become a nurse when she was younger. Absolutely. Angela, what about you?
Mine was, I was actually about 4 or 5 years old.
Okay, really young. Yeah. Okay, y'all, okay.
So a little backstory is that my father had me when he was about his mid-50s or so.
What? Okay.
So obviously when you're up that age, you're not as youthful or as energetic as you used to be. So me being the little energetic little kid I was at that time too, he would come to work, or he would come home from work, and he would just be like, so there's some days where he'd be like, okay, yeah, we can go play, we can do whatever we want. But then there are some other days where he's just like, I'm just tired, flat out tired, and so he'll be in bed resting, and I'll be like, are you okay? Are you okay? And he'd be like, and he'll try to play it out, and he wouldn't tell me that he was tired or exhausted. He was just like, oh, my stomach just feels funny or something. And I used to always hear it all the time, and I was like, oh, you have worms inside of you.
That's what you said to him?
Yeah.
Did he have worms inside of him?
No, it was just,
that was because you look for it.
Yeah, because when you can hear when you use that scope and hear bowel sound stuff.
Okay.
That. So I was just like, you have worms, and he goes like, you think so? He goes, yeah, they're really being really loud and noisy in there. And he goes like, well, that's because I probably have to go poop later on.
Oh, Lord have mercy.
And I go, well, do you? He goes, not right now, but maybe later.
Oh, my goodness. Okay.
And you say you were 4?
Yeah.
Wow.
So we always did that, and then he would always show me where little pulses are. He's like, you hear the little beeping noises on me?
Wow.
And I'm like, yeah.
So your father inspired you to become a nurse?
Yeah.
Wow. Okay, that's great. Family and your own personal conditions, I guess, could make you want to get into a healthcare field. Absolutely. Let's talk about this. I did tell the audience that, I was one of your instructors in nursing school. Do you feel like nursing school prepared you for the field? Why or why not? Let me clear my throat right quick.
Let me clear it up.
Yeah.
I'm gonna go ahead and politely say no.
Okay. Okay.
That's a polite way to say no.
Okay.
I would say no because honestly, nursing school prepares you to pass the NCLEX.
Okay.
And especially if you go into a specialty, like I'm in oncology. Like seriously, I'm gonna ask you, how much of oncology do you think we learned?
Well, yeah, none at all. Not just
Yeah.
about WBCs.
Just the basics.
Like, just
Yeah.
the basics,
Just
right?
like the terminology, and that's it.
Yeah. So like I really had to learn that on my own. Like I really had to take the time out of work to really just understand oncology, you know, the disease processes and what could happen to my patients, you know. So really you know, you have to do that work on your own. So
Okay. What about you, Angela? Do you think nursing school prepared you for the nursing field? Why or why not?
Absolutely not.
Okay. Okay.
And to be fair, though, no matter what you do or wherever you go, you're never prepared.
yes.
Like,
Okay.
And even like you go to school, you learn about the books, but you don't learn about like, what about the other factors of said patient, or what about this type of factors, or what if you're like, I know like they teach us like, oh, this is like the S bar. It's like, oh, you know, you're going to learn your S bar and stuff like that. That doesn't always apply to the doctor. Sometimes they'll just like be very condescending to you and just be like, okay, yeah,
Ooh,
whatever.
you said that, Arnisha.
Yeah.
We do got some
And
condescending physicians out there for sure.
And so you always have sometimes like you're just like too stunned to speak about it.
Yeah.
Like, excuse me, like, did you just speak to me like that? Like, why don't you come and see blah, blah, da, 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 da. But then like, you also have to remember, it's like, well, they didn't teach me this in school, or like, well, they didn't teach me how to do this. And like, but no matter where you go, you're going to have to learn different things and adapt to it.
Yeah.
Right.
So you think nursing school didn't prepare you necessarily to interact with other members of the healthcare team like a physician?
Correct.
Yeah. Okay, I got you. You know, when you're in nursing school, NCLEX is a perfect world. So you have a nice physician. They have the time to speak with you. You have the time to speak with the patient and, you know, do all the things that, you know, we teach you to do. But when you get to the real floor, when you get to the units, it's very much a gray area. You ain't going to have a lot of time to do much anything except for take care of your patient, chart, and pass the meds. You ain't even got enough time to take care of yourself and your own emotional needs. So I can see that. Nursing school prepare you to pass the NCLEX? It's a initiation to get into nursing, but you have to do your new grad residency, your new grad training, and that could take, if depending on what area you're in, it could take almost a year. Mm-hmm. So that's another factor too. And you both came from accelerated programs, right? Mm-hmm. So that's something to think about too. What has been some challenges? I know you spoke about this briefly, but what other challenges have you been experiencing as a new nurse?
Asking for help
because you want to do it all by yourself. You want to put that cape on. What about you?
I'm gonna ask for help.
Okay, I need some help. Okay,
yeah, I'm gonna ask for help. And you know what? And you may be good at this, but for me, it's analyzing labs. Because everybody has their different trends because of their own disease process. This is for me in my specialty because of oncology. So, they may have this type of cancer, that type of cancer. So those low labs may be good for that patient. That may be their trend.
Okay.
So I have to learn different types of labs for that type of patient or this type of patient, because you may be going to a doctor, running to them about this low hemoglobin, and it's like, oh, well, they have this type of, what you doing?
Right, or that's an improvement.
Yeah, that's actually an improvement. What you talking about?
Okay.
So I've had to learn that over, my time in my career.
Absolutely. Okay. And you said some challenges you experienced, Angela, is asking for help. Mm-hmm. Do you think why are you afraid to ask for help?
It's not that I'm afraid of asking for help. It's more so thinking it's like, oh, I think I could do this on my own.
Okay.
Like having that mentality, especially it's like you grow up and you learn how to do everything like independently. And then
Facts.
When you're putting yourself in a situation of like having like a very small group and stuff, it's like, okay, so it is a small group, but now all of them have to do their own task and completions,
Right.
So it's like, who do I call? Who do I ask? And then sometimes like, oh, well, you shouldn't take everything on your own. Like if you can't do it on your own, just go ahead and ask. And it's like, yeah, that's easier said than done.
Absolutely. So, that would stress you out if you have to just keep on taking on, the bulk of everything. That'll definitely stress you out. Anything you wish you would have known before starting the profession? Like if I say, hey, Arnisha, I want to go become a nurse, what do you want to tell that person beforehand before getting into the profession?
I would tell whoever is going into nursing, say they're in nursing school, I would say just remember to give yourself grace, because I did it when I started the program. I was so hard on myself, but you got to remember you're a novice at this. Like how it's like a baby trying to walk. You know, come on, you're still a baby, and we're still babies, honestly.
Okay,
like you're gonna make mistakes. You're still human, so just be calm and patient with yourself. You have to be. Even in nursing school, you have to be calm. Just try your all, give your best, put your best foot forward. And I still say that to myself because I get so mad sometimes, but I have to give myself grace. That's what I say.
That's what's up.
Yeah,
That's funny because I actually say the same
you say
thing
the same thing.
Give yourself grace.
Give yourself some grace.
Yeah.
Do you know? Okay, what about some nurses? Do you? I don't want to say that. Okay, let me segue to something else. One thing. Okay, so you wish you knew you should have given yourself some grace. Give yourself some grace is what you're saying when you start the profession, because no one knows everything. I don't know everything either. No one knows everything. But what would you say to a student that is in school, a student nurse? What would you tell them besides the grace portion?
I think if you are a student and are working a part-time job in a medical field, I think take advantage of it. Ask your manager or ask your educator that's on that field or on that floor or the director of the whole unit to see if like, hey, can I shadow a respiratory therapist? Can I shadow a clinician? Can I shadow a charge nurse? Can I shadow a nurse? Because for me personally, I did a really smooth transition just because I shadowed all these other people on my time off.
Good.
When I was in nursing school. And I think it was really helpful compared to others who were already working there and transition, because then they're like, well, what exactly is the role of, like, when you call rapid, like, what exactly are they doing? And it's like, well, I shadowed them too, so I can tell them, it's like, well, this is what they do, da-da-da-da-da-da-da.
Good. To shadow other members of the healthcare team. That's actually a great suggestion. What you got, Arnisha? What you think?
That was really good.
Yeah.
That was really good.
That was good for sure.
I remember I was in my clinicals. I was so stressed out. I don't know. You remember this because I was really stressed out because a lot of things were going on in my life. I had gotten a car accident. Like everything was going on. And sometimes it's like this in nursing school. I don't know why it all has to happen in nursing school. It's like a thing. But I just remember telling myself this every day. If I could just get through this one day, I could get through the next. Just one day at a time. And sometimes you really do have to talk yourself through this because you feel like you want to quit. I don't know why, but just one day at a time, just tell yourself, you got to talk yourself through it because sometimes it's just a lot. But just tell yourself one day, I can get through this one day, and then wake up and the next day. You got this.
You got it. Okay. All right. The other thing too, so it has been, so I have a couple of current nursing students and they asked me all of this. They asked me this question. They say, should a new grad nurse negotiate their hourly wage? Do you think you should be asking for more money as a new grad nurse? I know this is very hard. This is hard to, like, if someone passed you this paper like, here, I want to pay you this. Do you slide it back and say, nah?
I think
What would you? I mean, do you think you should negotiate your salary or your hourly wage?
Only negotiate the salary only, not the wage. Only
Okay.
if you have all these other job offers already planned out, and then you say like, look, you don't need to specify, which location or which job is hiring this, but just say like, I have other people that wants to hire me and they're paying me for this price. Do you think you can match that or give me a higher pay at that?
Ooh, okay. Is it all about the hourly wage, or do the benefit package matter, and does like a work-life balance matter? Like what, do you want weekends off? Do you want to do Monday through Friday? Do you think those are also factors even if the wage is lower? How you feel about that?
I say all of that matters.
Yeah.
Okay.
I also
Because
that.
And it depends on you. Because
Okay.
some people like working nights, some people don't mind working weekends, and it depends on, do you have a family? Do you you don't mind? Because at first I didn't think like working weekends or missing holidays worked, but being a nurse is totally different because I was a PCT. You can kind of just wing it. You can wake up right before the shift and keep going.
Facts.
No,
My gosh, she ain't
absolutely not.
for sure.
Absolutely not.
Okay.
Because as a new nurse, you want to get there early.
Right.
And sometimes you got to stay there late because you don't know how to chart.
You
don't know how to time manage yet.
You don't even think these nurses going to show up. They may be calling off.
They may be calling off.
Staff would be a trip for sure, especially on the holiday.
Yeah.
The worst days to work at a hospital is Mother's Day and Super Bowl Sunday, especially down here in Texas. Yeah, so if you can get Super Bowl Sunday and Mother's Day be the days that people love to call off. Christmas, New Year's maybe, everybody want that because the Mother's Day and Super Bowl Sunday is not time and a half, but it is celebrated. Okay. It is celebrated. So yeah, they be calling off on those days for sure. So good. Okay. One more thing. So we talking about money now, right? What has been your major purchase as a nurse?
Okay. So I got a luxury apartment in the Heights.
Yes. You got to tell nobody where you live at. Yeah. We gonna beat that out. So she has a luxury apartment. Okay, good. Okay. They gonna try to find you, Arnisha. So
hold on, thoughts in time.
Wait, for real. Okay, so you got a luxury apartment. Okay, that's what's up. What about you, Angela?
I just, I actually spend my money first on my family.
That's
and
what's up.
Got them all cute little presents or
okay.
big purchase on presents on, the things that they wanted. Like what's something that you actually want. And then for me, I just bought myself a gym membership and I was like,
that's what's up.
Well, you need that.
Yeah, because we need to be fit, healthy nurses. Yes. In order to do our job, you definitely need to be.
Have more strong arms to lift
Oh
them.
my gosh! Wait, you need strong arms to lift your patients.
Yes,
that is funny because ain't nobody helping you lift the patients because we ain't got no staff.
Good.
You call me like I'm busy right now. Like, all right,
okay.
I'm on lunch right now. You may have to get somebody else for sure. And then what you say, you end up usually doing it by yourself anyway, which is not necessary to move, right? We don't want to be doing that, but because you can hurt yourself if you, y'all gonna look. I had to wear a back brace for a little bit, like a brace for my abdomen and stuff. So just be careful with that for sure. Mm-hmm. Okay, so I don't know what else. Is there any final words you want to tell new grads or nursing students about the field? Any last remarks?
Be patient with yourself.
Okay, patience.
You're always gonna get frustrated with whatever it is. Like let's say like the grade you got, or you feel like when you are doing like let's say you're doing like an assessment on whether you're in clinicals or you're doing like a practice on one of your fellow student nurses and such, and you're like, oh, I forgot this. Now you're beating yourself up. It's like, no, it's okay.
Angela, first and foremost, I had you in clinical. I remember when we ain't going to tell you what the clinical site, but we had a code blue. It was a code blue, and I said, y'all just go to the code blue. And when y'all came back from the code blue, they was like, yeah, Angela did all the CPR. And I was like, what? I was like, yes.
Okay.
I was like, for real. They knew the hospital a little bit better, the layout of the hospital better than I did. So they knew where to go for the CPR. And they said Angela was doing the main CPR. She was doing them chest compressions. And I always told y'all I thought you was such a great nurse. And I think you're, a great nursing student at the time. But now, look at you, a whole, orthopedic trauma nurse. You know what I'm saying? That's what's up. What about you, Arnisha? Any last remarks?
Yes, I say it's okay to just try to find, especially that you love, because then that would be how you love your job. You'll wake up in the morning just ready to go to work, because sometimes when I was at a job that I kind of was unsure about, I had pre-shift anxiety and post-shift anxiety. I kind of just didn't know if this was for me or, something like that. And, maybe you just want to find a different specialty that you love and fall in love with that specialty, study for it, and just you'll want to do it every single day. And that's just my encouragement for these new students that'll graduate. Y'all got this. It's okay to take your time to fall in love with a specialty.
Yeah, it took me a while to find out. It took me a while to find a specialty that I liked. But the pre-shift anxiety and the post-shift anxiety is a real thing.
It is.
I remember when I had to float, like we discussed earlier, I would have chest pain. Because first of all, you don't know the nurses on that unit or the staff. You don't know the codes to get into their rooms and stuff. Just things like little stuff like that. and you talk about asking people for help. I don't even know any of these people, so how am I asking for help? I don't even ask people on my own unit for help. So it's just one of those things. So like, yeah, so that's what's up. Thank you for encouraging these new grads and these nursing students for sure. Do you want to tell people where to find you at, your Instagram or anything like that?
I don't even know my Instagram by heart.
That's okay. You ain't got to tell them where to find you. I know where to find you. And I want to invite y'all back onto this show. I may have a different topic. I know this is my new grad edition. This is a new grad edition number 1. But I may have you all back on again to talk more about your field and things like that.
Okay.
So I really do appreciate y'all being on and coming to see me.
Of course.
And this podcast is going to go out to some of the students that I teach now, and of course previous students who are our nurses now. So I really appreciate y'all, coming to kick it with me just for a little bit. All right, so this is the 4th episode of the Up Next Nurse, and I will see you again. Bye.
Lately I've been living my life. I don't pay to hate no mind. Doing better things with my time. Yeah.